So I'm going to hand over to Dave and Sam, who I can see Dave's here, for their next session, which is about nature and health, tackling and preventing mental ill health through green social prescribing.
Thanks, Matt. Hello, everybody. I'm Dave Bell, Principal Advisor for Health and the Environment at Natural England. And Sam Alford is also with me, who's a Senior Manager for Green Social Prescribing in NHS England. Sam, I can't see you on my screen, so I'm assuming you're with us. I did see you on the chat earlier, so I think I'll kick off and give sort of a bit of context around. Is audio going strange for the people? Is it just me?
Is the audio going strange for the people?
Sam's taken himself off mute and
Seems to be a delay.
Gee.
There's Sam. I can see Sam on the screen now. So I'll kick off to a bit of context around health and the environment and the way we're seeing that in Natural England, and then Sam will give more context and context around delivered green social prescribing pilots, with sort of cross government, cross sector piece of work which we're really excited about, and is coming into sort of the end of its first year at the moment. So I should be able to share my screen, and we'll see some slides. Matt, can I check that they're coming up?
Yeah.
Yeah. Okay. Brilliant. Are you seeing it's full screen, or are you seeing notes?
Full screen.
Full screen. That's perfect. Brilliant. So yes, this is Sam and I. And firstly, I want to sort of share Natural England's vision, really. So we're a government-funded agency. Our vision is to create thriving nature for people and the planet, and that is through building as big and diverse partnerships as we can for nature's recovery. We've got a number of statutory roles, one of which is around nature conservation and species conservation, but equally it's around connecting people with nature for health and well-being. So this is me, my role. This is how I connect with nature. This is my local reservoir, some organised swims out there. And actually my role is to look at our overall strategy for health and the environment, understand the benefits and how we can translate those benefits into decision making at all levels. And then we have an area team model. So we have 12 area teams covering the country, which look at how we can deliver environmental benefits for people's health and well-being. And green social prescribing and the pilot that Sam will talk to later is a big part of that. So as I said, looking at how we can translate the environmental benefits into decision making, and a big part of that is also working across government to look at how that feeds into policies of we've got other government departments, so not just DEFRA. I think in the past, Natural England's primary relationship has been with DEFRA, so that's the Department for Environment, Fisheries and Rural Affairs, but now more and more with Department for Health, Department with Levelling Up, Housing, Communities, and Department for Transport and others. So at a large scale, I think just the way our work around human health and the environment can fall into sort of two broad areas. I think one is around engaging with nature. I think that's what we'll predominantly focus on today. So that's the health benefits that people get from engaging with nature. But the other area is around ecosystem services. So the value and the health benefits that a thriving natural environment can provide. For instance, how the impact on air quality. So there was an FTEC estimate in 2017 that vegetation removed 1.3 billion kilograms of air pollutants in 2015. So from that, we can start extrapolating in terms of health benefits, which they looked at in terms of a reduction of 7,200 fewer hospital admissions. So these are the sort of some of the conversations that we want to try and get into in terms of embedding nature and thriving nature into people's lives more generally. And there is a big, an international swell around this too. So the WHO and IUCN Working Group on Biodiversity, Climate and health is, somewhere I think just a bit of signpost if you're interested in that more broad sort of ecosystem services approach to health. It's one worth having a look at. And obviously, the theme of today, and hearing some of the discussions that we've had so far, I think it's not just engaging with nature, but it's also getting the dirt under your fingernails and the benefits that you get from that. And some recent studies looking at sort of the microbiome, which is really high on sort of health agenda at the moment, looking at the soil microbiome and some of these mirroring effects that drugs such as Prozac has on your neurons. So you can get really deep into lots and lots of aspects of this. But I think for the main part, I want to talk about how connecting with nature helps for health and well-being, and I don't expect a lot of this will be new for you. I think it mirrors what we've heard so far. A big headline there around 2 hours a week in nature is associated with feeling healthier and happier, and some of the benefits that we get from physical, mental, and social. And we've also been looking specifically about benefits for children and young people and older people. And that's becoming more and more important, I think, where we've seen some of the headlines around children's mental health post-pandemic and how we can support an ageing population. But we all know, and I see it's coming from not just the green sector saying that nature's good for us, but also the health sector more and more embracing this now. So we need to look and scale up and think about how to use these benefits to try and translate them into sort of national influence. So a lot more you'll see things like urban green space values and natural capital accounting. So London and Greater Manchester have published their natural capital accounts, and they've looked at things like avoided healthcare costs of local green spaces. And so you can see those there, and that's made up of increased physical activity, but also mental health and well-being benefits. So I'd say if you're interested in that, sort of how you can translate that, there's some really good stuff out there, and send links to. And also, I think I mentioned the shift from a green push for investing in nature for health and well-being to this being recognised and focused on in the health sector. We've got the Public Health England report on improving access to green space there, which recommended that local authorities consider their parks and green spaces and blue spaces as critical assets for the health of their local communities. Sam will talk more on the social prescribing side, but also our partners such as the Wildlife Trust done some good research on social return and investment. So actually being able to quantify that for every pound spent and invested, they I think £8.50 back in sort of social return on that type of investment. So I thought I'd share a few reflections on sort of what we know through the COVID, how things have panned out through the COVID. And the next few slides are based on our People and Nature survey, which is a national survey, sort of representative sample, which has been going. Predecessor was the MENI survey, which was monitoring engagement with the natural environment, which has been running for over 10 years. And thankfully, I think we've changed the title and revised that survey recently, so it's now called the People and Nature survey. But this really highlighted an increased connection with nature, I think, during the pandemic, but also how there remains significant inequalities in terms of access to nature and people accessing nature and the health benefits they receive. So the high level findings around there, consistently looking at the connection with nature, and being time in nature makes people feel happy. I've put the stats for children in there as well, because last year we launched the Children's People and Nature survey. So I think there's also a growing acknowledgement and set of data there that people can access in terms of looking at children's connection with nature and issues relating to that. So It's great. It's a great anchor to have. It's really powerful set of data which shows that there's a connection between nature and health and well-being. And specifically around the pandemic, we looked at whether people's perceptions of nature linked to their health and well-being had increased during the pandemic. So there's also that evidence that shows that people are seeing their connection with their local green spaces, with nature, has been even more important since the coronavirus restrictions began. But of course, it also shows that the data also shows that this is not sort of a benefit that people can access or is accessed equally by all. So the green bars on this are those people that spent time in nature in the past 14 days, and the grey bars are those that haven't spent time in nature in the past 14 days. So you see in the most deprived areas, there's almost, you would say half of those living in the most deprived areas are spending time in nature and half aren't, and that changes drastically when you look at the least deprived areas. And similarly, that trend is similarly seen in terms of household income, with those at the higher household income spending more time outside. So we know that access is not equally available to everybody. Those in the most affluent 20% of wards have 5 times the number of parks and green space than those in the 10 most deprived wards. But there is sort of a sort of a hopeful element to this as well, I think, in terms of nature's solutions to some of these problems, or the role that nature can play, which is that for those who are living in deprived areas, there seems to be an even greater impact, or where there is availability and use of outdoor space. So there seems to be something that we can do in terms of accessible green space and connecting people with nature in those deprived groups, which will have an exponential, an even greater impact than those in higher sort of wealth and socioeconomic groups. So very quickly, I'd want to mention our work on green infrastructure standards and mapping, which is in part trying to highlight this challenge across the country. So green infrastructure is just a fancy word for sort of nature close to where people live. It's in a way equating nature and greenness with the sort of built environment. So the role that nature plays for biodiversity, for people's health and well-being, for businesses and growth, and also for reducing sort of carbon emissions, and etc., is all part of the package around the role that the green infrastructure standards, which is a national piece of work, is sort of outlining. There's a good bit of evidence review on the health benefits of green infrastructure that I can also send links to. But the other thing that piece of work has done is looked at mapping green spaces and accessible green spaces across the country, and overlaying that information with the area indices of multiple deprivation. So you can start to look at actually where is there gaps in provision, and where does that correlate to areas of high deprivation. So that's a tool, sort of there's a beta version online that people can use and look at, and go down to quite a local level to look at where there's accessible green space and how that maps onto socioeconomic factors. And the other piece I just want to mention is the growing amount of evidence that we're seeing around nature connectedness, which is distinct from time in nature. So nature connectedness is a sort of a deeper definition of spending time in nature. I think it's that social, it's that emotional connection with nature. And we do some work with the University of Derby and others on nature connectedness. But what some of the early findings are showing is that there's a greater benefit to people who are connecting with nature rather than just simply spending time in nature. So the green circle there is sort of tries to visualize the link between nature connection and health and well-being outcomes, and the nature visits is the blue dot. So there's an additionality that we get from nature connection. And the way I think of it is, if I would walk around with headphones in, listening to a podcast or listen to some music, I would be spending time in nature, but I wouldn't be connecting with it. So it's a difference between taking the headphones out, really connecting with my environment where I am, and the health benefits we get from that. So in summary, we know that being in nature makes us happy. Nature and connecting with nature has been particularly important during the pandemic. And it's really, you know, we'd love to be able to capture that sort of engagement that people have had with nature and build on it, so it becomes sort of a longer term behavioural change. We know that benefit is not equally distributed across society, so we're looking at tools and techniques to try to target work and interventions so that we address health inequalities in the same way as addressing inequalities access to nature. But also that final point that there is a growing amount of evidence that is looking at the connection with nature rather than just time in nature. So the additional benefits that we get from programs which actually connect people with nature, that get down and get the soil under the hands, you know, and really make that link between people and their environment. I think with that in mind, that final piece really about connecting people with nature, I think it's a good time to move on to Sam to talk through the pilots, the preventing and tackling mental health through green social prescribing that we've been running. So I'm going to move on to Sam. I'll move through the slides and hopefully Sam can hear me now.
Fantastic. Thank you very much, Dave. And good afternoon, everyone. It's a delight to be here. So thank you very much for the invitation. I'm just going to say that I have had a few connectivity problems this afternoon already. I've been thrown off the call a couple of times, and I'm actually out on location. I've been visiting one of our green social prescribing projects this morning. So I'm going to turn my video off while I'm speaking, but I'll turn it back on if we have time for questions afterwards. So I'm going to say a little bit more about the Green Social Prescribing Programme to tackle and prevent mental ill health, and a bit about the delivery and what we're learning so far. So if I could have the next slide, please, Dave. Okay, so usually I would give a bit of background about wider context of social prescribing and where green social prescribing fits into that. I'm not sure I need to say very much about that actually to this audience this afternoon, because I think from the discussion and the presentation this afternoon, I'm sort of speaking to people who are already in the know. So just kind of to take us through it very, very high level, we all know that there are other kind of social and emotional and practical issues which impact our daily lives and impact our health and our well-being. And social prescribing is a holistic way to provide support to help people address some of those issues and connect people into community resources to build the confidence and the skills to be able to manage and develop their health and well-being. And we also know that 20% of GP appointments are about wider social needs rather than acute mental ill health. So that's the kind of the background, the context to why social prescribing. If I could have the next slide, please, Dave. So social prescribing is also one of the key mechanisms, as you're probably aware, through which we're going to deliver personalised care within the long-term plan. So there was a commitment with the long-term plan to deliver universal personalised care and to recruit 4,500 additional social prescribing link workers to work in primary care, and also to reach 900,000 people and offer social prescribing to them by the end of 23, sort of beginning of 24. So as you can see on the right hand side of the slide, December 21, some significant progress has already been made towards those targets. And obviously social prescribing is just one way in which we are aiming to embed personalised care. So if I could have the next slide, please, Dave. So lots of health benefits to green activity, and Dave has described very powerfully, and also previous speakers, the positive physical and mental health benefits of connecting to nature. But this programme obviously focuses very specifically on mental health, and therefore our green social prescribing definition reflects that. So what we're saying is green social prescribing is the practice of supporting people to engage in nature-based interventions and activities to improve their mental health. And again, we're focusing on the whole journey, so the act of actually prescribing, the holistic conversation that a social prescribing link worker or allied professional has with somebody to identify what is important to them, what matters to them, and then the act of connecting them to the prescription, which in this case is a green activity, so connecting them into an appropriate service or activity within the community. And obviously activities can be very varied, anything from local walking schemes, community gardening projects and community allotments, green gyms, forest bathing, arts and crafts activities outdoors. And it's really important to highlight that we're also looking at green and blue environments. So we have quite a few wild swimming projects, for example, at the moment. So if I could have the next slide, please, Dave. So you may be wondering who the target beneficiaries are for us, and because we're working to embed green social prescribing both within the social prescribing pathway and also within mental health pathways, it sort of takes us on a bit of a journey, and it moves us up from the traditional social prescribing territory, which is generally around or has been historically around working at a universal service level and having something that's available to the whole population. And it's taking us into working with people who have, perhaps more complex needs, people with mental health, identified mental health need, who would benefit from some targeted support. So we're kind of working across those first two levels. If I could have the next slide, please, Dave. So in terms of project objectives, there's quite a few objectives that we're working to, and the main thing is that we are looking to improve mental health and well-being, and we are testing the efficacy of these non-clinical interventions within the mental health pathway, and we're working across that whole mental health pathway. So working with people who've got identified mental health need, perhaps who might come and see their GP, for example, and are showing the early signs of their mental health and their emotional well-being perhaps being at risk of deteriorating, maybe because they're lonely or socially isolated, perhaps maybe they've been bereaved or there's something else significant that's happening in their life at that point in time. And then we're also working with people who have mild to moderate mental health need, and they're people who may be already in the system, maybe they've been offered more traditional interventions, maybe medication or talking therapies or something like that. And the programme also works to support people who have more severe and enduring mental health conditions as they recover. So we're trying to embed green social prescribing into their recovery journey. And we've got several projects which are working in partnership with hospitals and hospital gardens in order to support that sort of journey moving forwards. And obviously we are really keen to be able to reduce health inequalities and to cite this work in communities where there are higher than average levels of health inequality and reduce healthy life expectancy. And we've used a very, the golden thread on this programme has been around co-design for the programme. And that's to make sure that we're really reaching out to as many people as possible and delivering the programme, designing the programme in a way that hopefully makes sense to local.
We lost Sam.
Sam's disappeared for everybody.
I think we might have lost Sam. I'll try and pick up the thread if that's okay.
Thank you, Dave.
Somebody joins us, come back in. So I think yes, talking about the project objectives there and the golden thread around co-design. I think is where Sam left us. It'll really help us to understand actually how do we need to deliver this in a place so it's not one sort of one size fits all solution, but actually how we can, as national bodies, with sort of also with local representation, how we can support that local need and address that local need. Yeah, so this is the overview of the project. So the seven sites where the project is looking at. So there's obviously the delivery element to that, but there's also a couple of sort of national pieces of work that's alongside that to evaluate the impact. So there's a national research piece of work and ongoing evaluation, which will look at the sort of local and national actions and the impact of those. The 7 test and learn sites are there up for you to see. So a cluster sort of in that sort of North Midlands band, and then around Surrey, Heartlands and Bristol and North Somerset. So, so this slide really talks, I think, is picking up actually on how we need to align green social prescribing with the new integrated care systems and the objectives of those integrated care systems. So this is a new sort of delivery model for the NHS, which brings together health and social care into one place. So we're really looking at how green social prescribing and the pilots will fit into that. There's a big role, I think, for or there is a big role in integrated care systems for VCSE partnerships, and also, how green social prescribing is going to be represented within those is something we're really keen to explore. The national research work that I mentioned, so there's a number of pieces on this. This is how we actually build on the insights from the test and learn sites and the evaluation that they're doing, so that we can look at actually how we can scale up green social prescribing and how we can support that scale up nationally. So the national research has two strands that you can see on screen there. There's a sort of a long-term clinical or test looking at how effective green social prescribing is on specific outcomes and mental health conditions. And there's a sort of a shorter term social research element to that, looking at scalability and accessibility. Alongside that, there's a formal evaluation. I can see Sam back on screen. Sam, did you want to pick up again from the evaluation point?
Yeah, thank you very much for covering. Apologies to everybody. Just one of those things, isn't it, unfortunately. So yeah, thank you. So the evaluation of the programme, the whole programme is being evaluated, and it's more of a process evaluation actually. So we're looking at outcomes for individuals, but we're also looking at value for money and looking at some of those systems enablers and barriers really to embedding green social prescribing, and looking at kind of what works for whom and in what circumstances. So it's a developmental evaluation. They're taking a mixed methods approach, and the contract has been awarded to a very experienced consortium of universities working together. So they've got a lot of experience working within the social prescribing field and also within the nature-based interventions field. So if you could give me the next slide, please, Dave. So what's next in green social prescribing? So there's some learning, emerging practice that is coming through. We're not going to be able to report on the evaluation until next year. That will be post-programme June 23. But we are already starting to develop some learning through practice, and there are a few things that we know are really important in terms of the wider context to be able to deliver green social prescribing. So things like, we know it's really important to have leadership and champions at all levels of the system, so that practitioners can get behind it and work in different ways, but they are actually supported to be able to work in different ways, through their organisations, and that kind of vision is embedded in local sort of strategy and move forwards. We've got some really excellent examples of strategic partnerships happening on the ground in the green social prescribing sites, bringing together health sector colleagues, local authorities, voluntary community and social enterprise sector organisations, public health, communities and green providers who are part of that voluntary community and social enterprise sector. We know that it's really important to target this work in areas where there are high levels of health inequalities, and to use our data in order to do that, so that we're enabling people who have most to benefit from these services but are least likely to be able to use them, to access them, or to be able to use them independently without support, that we really target to those people. And we've had to do a lot of workforce development work, working both with our health colleagues and our VCSE sector colleagues, building the resilience of the kind of green community, but also making sure there's a mutual understanding between health and green providers about the benefit of green social prescribing, what constitutes a helpful referral, a good referral into a green provider. And then finally, this won't be a surprise to anybody, but we're having to do a lot of work thinking about how do we redesign sort of pathways so we can embed this for the future, make sure it's here to stay, and also how do we fund it for the future. And at the moment, obviously, the situation is quite a lot of piecemeal funding, and we need to look for different mechanisms where we bring the number of different opportunities together to try and make more consistent and predictable really for the sector. So just finally, our call to action is please help us champion green social prescribing to prevent mental ill health, and obviously all of those wider wider impacts that we know it can have. And I don't know if I have time, but I did want to just share one very quick example with you. If I could have the next slide, please, Dave. This is an example that I picked up on the BBC actually, and some of you may have seen it, and I think it's a very powerful example. So it features somebody called Nick Gray, and it was about his journey to managing quite severe depression over a 30-year period, and he does that with sea kayaking. And what he says is, when I'm paddling against the tide, I know that in a few hours I will be helped along by it. In terms of depression, when I'm really struggling, I know that it won't last forever and that better times are ahead. And I think that's very powerful, and I think that kind of says it all, really. So thank you. That's the end of our joint presentation. I don't know whether there's still time for questions, Carly, but I'm going to raise that with Carly and colleagues.